Welcome to Kidney Talk, a program of Renal Support Network, a show that streams health, happiness, and hope to the kidney community. You can download all Kidney Talk shows from iTunes and find a variety of resources to help you navigate this illness at rsnhope.org. Please welcome your host, Lori Hartwell, who has lived with kidney disease since the age of 2.
Well, welcome to Kidney Talk, everyone. I'm very excited to introduce Dr. Arun Malhotra. Dr. Malhotra is a nephrologist who was in private practice for 20 years in Newark, Delaware. Dr. Malhotra, tell us a little bit about how you got into nephrology.
First of all, thank you, Lori, for having me on. This is very exciting. This is my first podcast. So what I want to tell you is that about nephrology is that when I was in medical school, I had a mentor that really set an example of how to be a good physician, how to take care of the very sick people. Really, dialysis units those days used to be a place where nobody wanted to go. It was the early days of dialysis. And so, again, seeing him practice, learning from him really kind of mentored me into thinking about nephrology. And more so when I came to the U.S., I think I met some great physicians in nephrology at UPenn where I trained. And having learned from them, I felt like, this is where I want to be. So again, during my residency training, I was mentored by nephrologists who really felt like I need to emulate these physicians. And that's how I came to be in the field of nephrology.
Well, I've encountered a lot of the beginning nephrologists, and I'm here because of their brilliant work. And it was a breed of science and just innovation and burning the midnight oil so that we could survive and thrive with kidney disease. So, today we're going to talk a little bit about chronic kidney disease and high potassium. This is something that I know is very important. I myself have suffered a cardiac arrest from a high potassium. It was in the early days of kidney disease, and I was one of the first people to have a peritoneal dialysis treatment. And there were some problems, and we all suffered a high potassium, and I'll never forget the feeling. I mean, I never really appreciated potassium, but I just started to feel heavy, and it was just my muscles saying, we have too much potassium. Wow. And so it's really important for people to understand high potassium, what they can do. And so yeah, tell us a little bit about what potassium is and, how chronic kidney disease impacts excess potassium in the blood.
Sure. The body has phenomenal amounts of stores of potassium that it stores intracellularly. So while the amount of potassium in the blood is not as high, but within the cells, that potassium is at the level is manyfold higher than what you see in the blood. And the kidneys are primarily the filter for that potassium, and they have a phenomenal ability to dump that potassium out if it's not needed by the body and the cells. And therefore, they kind of maintain that level so beautifully well within the normal limits. But there is the body's ability to overwhelm that kidney's ability to kind of filter if so much of it is dumped on the kidney that it's just unable to tackle it. But despite that, with normal kidney function, the kidney tackles it very beautifully. So when the kidneys don't work well, that's when we see that potassium can build up in patients who have underlying diminution of kidney function, what you call chronic kidney disease. And again, it could be because of excessive production of production or dumping of potassium in the blood, or translocation from within the cells out into the blood, or the kidney's inability to dump it out of the body, or a blockage in the flow of urine. So there's many reasons why the potassium can go up, but primarily the kidney helps. The kidney is the primary filter of that potassium out of the body if that needs to be dumped out so that normal potassium levels can be maintained in the body. Now, patients get hyperkalemic, the high potassium level, when we see patients with acute kidney injury, which is like sudden kidney injury, or patients with chronic damage from diabetes, hypertension, obesity, smoking, drugs, infections, inflammation, autoimmune disease. So there's so many causes that cause chronic kidney disease, that a chronic diminution of kidney function, that lead to then manifestations of certain electrolyte abnormalities, one of which, and the most important one, that is the scary one, is the hyperkalemia, which is the high potassium. Now recognize that the normal range of potassium is fairly wide. It's from 3.5 to 5.0 when measured as a blood test. But once it begins to creep above 5, that's when you begin to get worried about the patient, because, patients will not recognize that they are hyperkalemic, that the potassium level is climbing up. It's usually a blood test that will be able to figure that out, and a call from the lab to the doctor, and that doctor then calling the patient to tell him, hey, we need to make some changes, we need to talk, we need to examine you, you need to come in, or many a times even say patient needs to get to the ER as soon as possible.
No, I mean, I just felt heavy.
Yeah.
I just felt heavy.
Yeah.
I felt
Yeah.
tired and heavy. That's all. That's what I felt.
And you could have alluded it to something else.
Right. I'm like, I'm just tired. That could be any symptom. I mean, it could be anemia. It could be anything. So it's very, very interesting. And I love how you explain the kidneys, because kidneys never get enough respect. They are the master chemists of the body. And when they're upset, just like when your computer's missing a little bug or something, you have to be careful. Your whole system can crash. So in addition to what I just said, how might someone tell they have a high potassium other than a blood test? Because there's no, you don't itch. I'm thinking, I don't itch. And it's really scary. It's really scary. And especially when you're just learning a new diet, because food drives your potassium level.
That's true as well. And that's the scary part, as I said, about high potassium. There's no symptoms. And even when symptoms come on, it's like maybe you have a little bit of weakness, you have a little bit of instability, and you're thinking, maybe I didn't sleep well, maybe I ate something wrong, maybe I'm catching a flu, maybe I just need to rest, and you don't realize. So again, high potassium similarly has very generalized symptoms like muscle weakness. Like you said, you were feeling heavy, your muscles didn't have that energy level, you may have nausea, you may have numbness or a little bit tingling. But at the very end, when potassium is really through the roof, that's when bad things begin to happen. You get, you can get an irregular heartbeat that can manifest itself and even progress on to becoming an arrhythmia or a cardiac arrest. Short of that, you can manifest with chest pain, shortness of breath, paralysis, vomiting. So there's other things, but that's too late, and that's the scary part.
It's too late. No, I mean, I'm thankful that when I felt, and I was young, I was 13 years old. So this was before a lot of the technology today. And I'll just remember wanting to lay flat on the floor. And my mom called the doctor and said, get to the hospital right away. And the reason I'm here today is I was at the hospital when I arrested. Wow. That is the reason I'm alive today. And I just remember telling the doctor, she was trying to examine me because they didn't have the technology. And I said, Dr. Crystal, I don't feel good. And that's the last thing I remember. Yeah. That's the last thing I remember, and woke up with a million people over me trying to keep me alive and bruised chest. And my most important thing, I wrote about this in a book I wrote, that my favorite dress that they had to cut off, and I was only 13, so I saw the dress, and I was just mortified that they cut up my favorite dress. And someday I'm going to find that material and make that dress. It's going to be healing. But it's the heroes in the room are amazing that work so quickly to save me. And so one of the things we talk about high potassium. What I've been told is, people need to eat a low potassium diet. And that's very important because you don't know how much potassium the body can get rid of based on the kidney function. And you kind of learn right over time by a lab result. So how does a patient, he goes in, they get their lab test, and how long does it take to get a potassium test back? You could do a stat one in the hospital, right? But when you're going to the clinic, they're sending it off and you don't get immediate results.
Sure, usually next day.
So that's why it's so important to have a low potassium diet while you figure out what's the right amount when they have kidney disease, correct?
Yeah, I mean, Diet plays a big role, of course, but again, many a times we know that the dietary recommendations will fail because of various things. I can have so many stories of patients who've manifested elevated potassium despite doing the right thing. Because many times they don't know what they're eating. Many times they go for a party in a weekend, they let themselves loose. A daughter cooks something special, they bring it in, they don't have the heart to say no. I mean, there's so many reasons why that potassium, despite that dietary management or dietary counseling or medical nutrition therapy, whatever you want to
Right.
call it, will still not work, and people will manifest elevated potassium despite doing their best.
Well, and we also at RSN, we have a nutritional calculator that can show all the potassium levels of raw food so that anybody can see it. Because I wasn't aware of some of the foods that I thought were high in potassium. I just think of bananas, but I didn't think of some of the other, tomatoes being high. There's a lot of things that are high in potassium. So, and there's a lot of choices of low potassium food too. So you just have to be kind of a student of nutrition when you have kidney disease, because that drives so much of what you're doing.
Yeah.
So there's some fruits that, and I'm curious, if you had to watch your potassium, fruits such as avocados, bananas, cantaloupe, honeydew, oranges, nectarines, kiwi, mango, papaya, prunes, pomegranates, dates, dried fruit, and dried figs. Now, which one would you want to eat and know, the frustration of knowing that, am I putting my health at risk? Do you have a favorite of those? Because I know what my favorite is.
Oh, I am big on pomegranate all the time. Mango, another favorite. Papaya, another favorite. So, again, it's hard for me to say fruits are healthy, right? So again,
It's hard. It's hard.
Yeah, it's very hard. And not only that, remember that most of our patients don't just have kidney disease. They also have a diabetic diet. They also have a cardiac
Right.
diet. Then, God forbid, they have a kidney stone. They have that kidney stone diet. So it gets so confusing.
It's
Patients
so
will bring me like a
confusing.
book sometimes and say, here's the diet. What do I eat? If I go with the stone diet, I can't eat that. If I go with the hyperkalemia diet, then I can't eat that. And it
Right.
gets very confusing.
I'm on a low phosphorus diet.
Yes.
I got to do this, but I need to raise my protein level, and
Right.
I'm at a convergence because when I was on dialysis, basically a diet in donuts
Wow.
was good. You know what I'm saying? But you're from California and you want to eat all the vegetables and
Right.
all the fruits and vegetables. And that's counterintuitive
Right.
to what society says.
Correct.
It's also recommended too because nuts and seeds and bran and milk and yogurt, they can be high in potassium as well.
Yep.
And a funny story, they concluded my high potassium at the level when I was a kid was due to butterscotch pudding.
Wow.
and it was not. The three of us had potassium problems, the three patients. But I was afraid of butterscotch pudding. I still can't eat it to this day. So,
Right.
but another source of high potassium foods that I wouldn't even think of. Let's review some of the low potassium foods because this has some of my favorite. Apples. I mean, I love apples,
Yeah.
and I'm an apple connoisseur. I don't know if you've ever thought of apples that way, but my favorite is Honeycrisp. I mean, there's so many different flavors of apples. I had no idea. And that's something I learned on my 13 years of doing dialysis, is apples are really amazing. And of course, frozen grapes are the best for, when you're thirsty and you want a little ice cube. These are all the tricks of the trade that we have at our support groups, and we talk to people about what to eat. I absolutely love asparagus. Asparagus and carrots are a friend, and I even love English cucumbers are so delicious. So there's so many fruits and vegetables that you can eat. You just got to learn it. And I think one of the
totally
problems patients have is that they don't do the cooking. Somebody else does the cooking. So what would you suggest? How does a patient talk to a family member? Like, this is serious because sometimes the family member's in denial as well. about the whole illness thing and not quite understanding that beans can't be for dinner every night. I mean, it's not something that is going to be healthy long term, and could be life threatening.
Right now, I think that, you've got to play the team game. I've always, in practice, if the patient was not a dialysis patient, but a late stage CKD and had issues with potassium that was elevated, I would actually go walk out to the waiting area and bring in the family that had accompanied him, whether it was brother, sister, father, mother, anybody who was there with him. I invited everybody into the room so I can tell them how important it is for this patient to manage their potassium, because sometimes even that one person accompanying may not get it, but if there are three people who brought him in, then it's better to get everybody in that room and talk to them and give them the list. And usually I used to have a printout, which was very handy, because on one side we had the hyperkalemic foods, the high potassium foods in red, and on the other side we had the low potassium foods in green. So I show them the red side first, saying this is what he's not allowed to eat, and everybody's eyes would pop and mouth would drop, jaws would drop, saying, what does he eat then? And you turn the page over and you showed them the list, saying, here, he's got a great choice: apples, blueberries, cranberries, grapes, tangerines, canned peaches, pears, pineapple, and the list went on and on. So once they saw that list, they were much relieved that there's so many vegetables like asparagus, cabbage, carrots, celery, corn,
Right.
radishes, turnips, water chestnuts, and some amount, very limited amount of raw tomato, and then of course the foods like rice, noodles, and pasta, and bread products. All of those were on that list, and you could at least tell them that, hey, why don't you take a look at this list, which is all the list of low potassium foods. And now with the advent of the internet and Google and of course the unfiltered kidneyconvos.com, you can kind of say, hey, go to this website, go here and learn about the high potassium foods. So I think the amount of help, support, and information available now is far easier and much more widely available than it ever before.
When I was on home dialysis, because one of the things that's high in potassium is chocolate. That's one of the food groups.
Yeah.
But I learned over time that I could have a little bit of chocolate and be okay. So it's not like everything's forbidden forever. You just have to be very careful as you incorporate and understand your body. That's what I have found over the years. And being on home dialysis gave me a little more leniency for my diet. So you always have to check with your doctor about that. So if someone thinks they have a high potassium, what should they do?
Well, clearly, if they feel that they have high potassium, they need to visit see their primary care, the healthcare provider, their nephrologist, and then discuss it out with them, saying whether they feel like they've had recurrence or they've had ongoing issues, and then A, figure out why, and B, then figure out what can they do to not have this recurrence. So I think when doing that, they need to, consider, understand what's the potassium level that's normal, and then if it's normal, when does it needs to be checked again? And if it's abnormal, when do you want to repeat it? And if it's high, then what are some of the treatment options that I have in terms of making my life easy, instead of kind of getting on a diet that is so rigorous and kind of punitive on the patient, as you pointed out, with their phosphorus restriction, with the protein needs. They, all of these restrictions will end up sometimes making them malnourished. And some people will say, I'm not going to do it at all. I mean, I have had patients who said, I'm not going to stop my mangoes. I live on mangoes. I'm going to keep eating them. I don't care what the potassium is. So there's, and they can be, they can be aided and supported in what they're doing after understanding that he's 85. How many things do you want to take away from him? And why not make his life easier by using some of the tools that we have in terms of, whatever we can do. So the healthcare provider does have answers and solutions for the patient. They just need to be sure to talk to them, discuss it, and bring everything that they are doing out in the open. For example, I found so many times that patients are on a diet full of lentils and they won't tell anybody because that's all they want. But if they would tell the dietitian or the physician, then we can work around it, because now we have ways to work around it.
We have treatment. It's very sad to hear some of my members in my group, like they don't want to go to social functions because they're afraid of the food. So they start to isolate themselves because food is such a big part of our social fabric. And we need to not go and be afraid to walk to the buffet table. I mean, it's like, I can live with some of but some of it's, they make food so pretty now. I mean, Pinterest is making food so appetizing because I just went to a Christmas party and I mean, every single plate looked like it should be on a Home and Gardens magazine. And of course, we eat with our eyes. So it's very hard to say no. To wrap up, high potassium is really important. And I collaborated with my physician, collaborate with a dietitian. And I think the most important thing is talking about it, having a discussion about understanding your labs. I mean, I have a happy dance when I get my labs and they look, now I know what everything means. And it's important that patients know what their labs mean, not just say, I'm going to ask the doctor about it. Know what each number means. Know what your sodium, your potassium, your phosphorus, all these levels, what that means and what you are able to advocate for your own care.
Right. Very well said. You said it so well, Lori. I don't even know what to add, but as you said, I'll just repeat a few things that you said, that it is a team's effort. It's like the pit crew. We all work together. Tell us what's wrong and we'll work around it. Tell us what you can, what you can't do, and we'll work around it. I think we need to encourage our patients to speak up and let us know, hey, this is what I do and this is what I need help. And we're here to help. We're here to work with our patients. And again, as you said, and there's so many support sites and web-based places.
There's a site called Kidney Conversations that you can check out. And we have a number of support groups. And, just to wrap up, high potassium can impact any stage of chronic kidney disease. So it's not just about when you're on dialysis. I think a lot of people believe that. I mean, you're more at risk when you are on dialysis. I know I was. And then when I got a transplant, my kidney just kicked back in, It's really a wonderful thing. But I do want to stress, because I know a lot of people are struggling this with when they're on dialysis, and advocate for yourself, because we dialyze to live, not live to dialyze. And part of life is about enjoying foods.
That's
and
true.
Family and celebration. So with that, Dr. Malhotra, I'm very, very happy that you're here today and advocating for this. I look forward to meeting you in person one day. And you guys can't see it, but he has got the prettiest background I think I've ever seen on Kidney Talk. It looks very fun, and it looks like a really pretty little room you're in. So I can see that happiness is part of your prescription, which is appreciated. Thanks. So thank you, Dr. Malhotra. We'll see you soon.
We'll connect again. Thank you so much, Lori, for having me. It's truly a pleasure talking to you and hearing about what you've been through, and what a story. It's an amazing story, very touching. And given what you do for supporting so many people across the world, thank you for your service, and thank you for being there for our very, our patients with kidney disease that really need a lot of support. So thank you.
Yes, we can do it, guys. We just got to be our own advocate.
Thanks for listening to Kidney Talk, a program of Renal Support Network. Please make sure to find us on Facebook or sign up for our newsletter at rsnhope.org. Kidney Talk is intended for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your physician. Always seek the advice of your own healthcare provider regarding your medical condition.